So moving on to flexibility tests, the first one that we are going to perform is the Thomas test. So I'm going to instruct the patient to step away from the table just a little bit, and I'm, just for purposes of this table, I'm going to hold it to make sure it's not flipping over, but I want you to go ahead and sit on the edge of this table just so that your buttocks is barely touching. Good. Next thing I want you to do is go ahead and lift your let's do your right leg up to your chest, hold on to it, and I'm going to slowly lower you back. Good. So I'm going to keep my hand here to make sure that excessive lordosis isn't occurring or that rotation of the pelvis isn't occurring as well, and make sure that this knee is snug close to the chest, and then I'm going to be looking at this angle of the leg right here. So first thing I want to check is to make sure that the femur is not touching the table, which it's not, and it's exactly parallel, so there could possibly be a little bit of iliopsoas tightening, but I would say this is a negative test right here. Next thing I'm going to look for is, oh, you can't even see. Next thing I'm going to look for is this angle here. Just kind of see how rectus is. It springs back up. I would say that she has a lot more work to work on her rectus, as it's showing some hypertonicity here. Iliopsoas is, I would say, negative. So that is a Thomas test. You can go ahead and sit back up. And next, we are going to have the patient lay down and test the hamstrings. So there's two different methods for this one. You have the straight leg raise and you have the 90-90. Straight leg raise, I would passively extend the leg, not allowing the knee to bend. And she gets to 90 degrees. Its normal is anywhere from like 90 to 120. I would test bilaterally, but you could also do the 90-90 straight leg raise. Nope, that's not straight leg raise. You do the 90-90 hamstring test. I'd say go ahead and hold on to the back of your thigh for me. With your other hand too. Just interlock your fingers. Keep it right here, and then I would just have you, I'll just extend her leg up, and she gets to about 85 degrees, so you can go ahead and relax. Anywhere from 10 to 20 degrees of complete leg extension would be a normal test. So positive would be anywhere 20 or less would indicate that you have hamstring tightness. The next one is the gastroc and soleus tightness test. So we're just testing the length here. So first thing I want to do is just go ahead and grab on, and I'm just going to apply a little pressure. Some tightness there. You have some tight calves? Alright, so I'm just going to apply some pressure. Alright, but I get to at least 10 degrees of dorsiflexion, so that means she is negative for this test. The next thing I want to do, that's going to test more gastrocs. I'm going to put the gastrocs on slack, so I'm going to go ahead and bend your knee. And now go ahead and just relax my hand. Now I'm going to bend a little bit further, which I get a little bit, not much, a little bit more range. That's taking the gastrocs out and solely focusing on the soleus. So next we have the piriformis test. So there's a few different ways we could do this. You could go ahead and, since it's an external rotator, you can go ahead and adduct. You feel stretched? And test the length that way. You can also go ahead. Can you flip on your stomach for me? You can flip on your stomach, and I'm just gonna move your leg for you. And what I want to do here is palpate the PSIS. And I'm just going to slowly rotate the leg out to the side. So right there I felt movement. That means that the there's some tightness, right? So it starts pulling on the pelvis and causing some rotation or movement to occur. So I have it noted. You could take a measurement here, but I have it noted in my mind about where that is at. So I'm going to do the same thing here. I'm going to come over, palpate PSIS, and I'm just going to internally rotate the hip. So this one seems like it has a lot more internal rotation. I didn't feel it start moving, so about right here. So I would say positive for piriformis tightness on the left side in comparison to the right side, which earlier in my findings I found that she had less internal rotation on that left side, so maybe it's contributing to the piriformis muscle. Next one, over test. Go ahead and flip onto your side with your back facing me. And I want you to just, can you back up just a little bit? Make sure the spine's in neutral. I'm going to go ahead and grab under your leg and just try to relax as much as possible. Typically I'd have the table a little higher. I feel like I'm bending down a little bit. So what I'm going to do here is I'm going to try and stabilize the pelvis, clear the greater trochanter, and then I'm going to drop the leg. Alright, so I felt the pelvis move very soon in the beginning. I just wanted to follow through with all the motion, but let me try it one more time. I'm going to go ahead and stabilize. Start dropping. I feel movement right there. So, there's some tightness going on with, typically this one would more test for TFL, but a lot of people group TFL and IT band. You could do the other version with the leg extended. So this is testing more IT band since it crosses over to the lower extremity. So for this one, I'm going to do the same thing, and I'm going to stabilize, and I'm going to clear the greater trochanter. Felt movement right there. Felt the pelvis pop in my hand. So, same thing. Pretty tight. Alright. So the last one, hip adductors. So for this one, I'm going to have you lay on your back for me. And I'm going to have you put your feet together. And then go ahead and just let your knees fall apart. So I'm comparing sides bilaterally. It appears to be that the left side drops a little bit more than the right side. So typically I'd measure the distance there if I really wanted to get an accurate representation. But I'd say that's decent flexibility. And that's all we have. So I'd say she's negative for this test.